Patient's report.
Ma'am, new practical skills.
It's new practical skills, yes. And again, you read information. First, you read information about your patient, full name, age, another information, and different contraindication. Next, you read information about your manipulation. This is name the medicine, doses, times, and way. Now you prepare to the intravenous infusion. You open your medical cabinet and take solution. What you will check?
Expiry date.
Concentration.
Volume.
First you check name this solution, concentration, volume, and after
color.
that, appearance, expiry date, integrity, and
Current expiry date.
Color.
clean
Color.
or not. Sometimes your patient needs more than one solution, and you can prepare and check. It's maybe one solution, but 400 and 400 half. Full volume it's 1 liter, and you prepare like it. Or it's maybe different solution, and you check and prepare this way before. Afterwards, you prepare medical items. For intravenous infusion, you need what you will need. AV system. Yes, you take this disposable device and check. What you will check?
When it's broken,
Experiment.
seal broken.
No, it's in a tape. It's really, it's must be disposable. You know. Afterwards, you remove and dry your hands. Put on your non-sterile gloves and continue your walk. Comment please, help me.
Hey, hulangin na.
Take the tweezers and prepare sterile material. Done. But now, using solution for antiseptic, what part you must clean?
Neck.
Neck of the body.
All time you clean up a first.
Senior?
You clean around and clean up a first with
No, I can listen to that. ये वॉशरूम में आने नहीं बहुत बड़ी ही नहीं gastritis.
And now you clean only
Top.
yes. Solution must dry. During this time you take AV. Open. Take AV in your hand.
It's used.
This package in
Package.
yes. And now you must check your AV. You take your system in the two hands and check. What name this part?
The can.
With special needles, with cap or aspirate solution.
So,
This is part. What name this part?
Bigger can.
body.
Body.
Body maybe border drop chamber.
Drop
Drop
chain.
With
Drop
part
chamber.
need for you, and you will regulate the speed. Your solution. This part
Regulator.
regulator, yes, and really when you take this system first time, all time this part will open. This part name.
Plastic, rubber.
Part, maybe not only rubber, maybe plastic with special cap, with connector.
Special part.
Yes, special part for addition solution. If your
Ah,
patient needs
addition solution,
addition
we can
medicine during your
Process.
AV, yes, you will use rubber or special part for, and this part needle
needle
to
or
the
infusion. Needle part, it's maybe pink, it's maybe green needle, it's maybe special catheter, like butterfly or special catheter intravenous.
Catheter?
Yes, yes.
Catheter.
You check your system and you start prepare. You remove this cap and perforate rubber stopper. And you need to stand in this position. You place this rail in rubber stopper and very fast close AV.
Check the group, пожалуйста.
After that, you there are many types of AV. More often you can see AV with special part for air. And for this type of AV, you can open this part and after that fill the drop chamber. For this part of AV, before you fill half part of drop chamber, you press and add solution. And after that, you open your AV. And now you see solution is flow, but more often it's well more difficult. For this type of AV, you need addition needle for air.
පිටික ලස්සන පිටිපස්ස වල.
And more convenient if you prepare pink needle. This needle you can take your hand, remove the cap, and perforate rubber stopper near the needle for solution. I understand why I do it, not? When solution will flow in venous, inside this veil stay negative pressure. And when more solution will flow, then more pressure inside. And speed your solution stay less and less. When air solution flow and air fill on this place. You right. And after that you again open AV and check what all air you see. Potentially I don't remove the cap, the needle, and make sure that bubbles is absent. Yes, you fasten AV on the stand, and you need stitch. How many pieces of stitch?
Two.
You need. Yes, of course. How long this part?
2
3
5
centimeters.
About 10 centimeters. Yes.
10
You
centimeters.
prepare
And 10
to
centimeters.
stitch.
10 centimeters or 10 centimeters.
And you can fasten it on your manipulative table or on the stand, like convenient for you.
Meter with metal.
And afterwards, you with your manipulative table and your stand, go in the patient room. More often, intravenous infusion will have long time, and more often you will get it in the patient room. You come to the patient room and start you communicate it. How you will do it? No, knock, knock, knock.
Knock, knock, knock.
Yes,
Everything.
it doesn't matter, the door may be open, but your patient must give you permission.
And blow your head.
And may I come in, how are you? And make sure that it's your patient.
Are you
Ask
unpaid?
about name, age, and
Six.
other your question, allergic reaction, and when you finish, explain the patient what you will do, name the medicine. Now I will give you intravenous infusion, name of solution, did you have this before, what do you feel, and other question, and after that you explain position. What position for intravenous infusion you will use?
In bed.
Yes, flat position.
Resting.
Please lay on your back. Palpate the hand and the
This I'll
hand.
put it in the hand. Can't you put here?
Oh, maybe
Bhagya.
it's but it is
Bhagya.
different. You know, in this part more often you will use special needle like butterflies. It's
Butterfly?
after after 2 classes I will show you this type of needles. Now more often with needles you bring you lay a special pad on the hand. Your patient close the bare skin clean napkin.
Bare skin.
With clothes you can do it without napkin. Ask your patient, please compress your fist,
your hand.
and after palpate the venous, you start clean. How many times you clean it?
3.
2 times.
Twice. What solution? Name of solution?
Antiseptic solution.
For skin.
Disinfectant.
Septocid. First time you clean
10 by
10 by
What
10,
the solution
and
is?
every time you move it
For skin.
up.
කලින් කියපේ වැරදි. For skin. Ma'am, what's the name of the solution?
Septocid, special solution.
Septosic.
Septocid. 5 by 5.
මේක out of focus ගිහලා දැන් focus කරේ ගන්න
After
වෙනවා.
that,
මම නිදි
you
මත ඉන්නේ.
take AV.
Please don't we take this thing to the hand?
No, now you don't need.
වතුර ඕන ඉල්ලුවන ඉවරයිනේ.
Needle for our phantoms.
Ah,
You can use big needle, but
සිරාවට
to our phantoms not
හැබැයි දෙන්න දෙන්න.
doing needles. If you change the needle before infusion, you remove the air from this needle. After that, you remove the cap. Place your needle like syringe, like pen, and you see open part the needle in down position. After that, you one finger stretch the skin and fasten the venous, and under angle 15 degree, perforate skin, perforate venous. When you see a drop of blood inside the heat, you remove the tourniquet, and you can check in venous you or not. You can so press connector, or you can open AV and check flow solution or not. And you check skin near your needle. If you make sure with you in needle, you close AV, take stick and fasten the needle. First piece you fasten the head of needle, and second piece of stitch you fasten under so down with connector. Yes. After that you open AV and regulate the speed. For example, you patient, you can read this information in your administration patient record list. Your patient need administrate solution will 15 drops per minute.
Solution not coming.
What it's mean? 15 drops. How you will count it?
Per minute.
15 drops per minute.
15 per second.
It's 1 drops in
1 drops in 15 drops in 4 minutes. 4 minutes.
seconds. You check. 1, 2, 3, 4 drops. 1, 2, 3. 1, 2, 3 drops. Next classes I will give you different task for each students, and every time you will regulate. For example, your patient need administrate solution 3 milliliter in minutes. 3 milliliter.
5 milliliter.
3 milliliter in minutes. Maybe speech in drops, maybe in milliliters. Please count.
Pressure
3 milliliter in minutes.
make it like the home air can go through,
3
right?
milliliter in minutes.
Pressure will be in a
Please count more fast. 3 milliliter in minutes. What is how many drops in 1 milliliter? No, 20. 20 drops in 1 milliliter. Your patient needs 3 milliliters. 60. What is mine? What is the speed?
One drop per second.
Yes, 1 drop. You can look on your watch and you regulate. And after that, you close the needle, sterile piece of gauze. Now I go see this material. Oh, now I prepare. It's mistake. My assistant. It's not sterile.
cutting is in one.
That you need.
Wow.
Not only cotton swab, you need sterile.
Wasn't here even.
For example, you have sterile. And after that, you take 1 piece of gauze and close this part. How are you? Are you okay? Please. You need It's not all. Next class is you will count how long time your patient will lay in this position for administrate all volume with solution. For example, your speed 16 drop in minutes, it's 3 milliliter, and you have 300 milliliter solution. How long?
300 milliliters.
600.
600.
No, 300 milliliters, and you administrate it with speed 3 milliliter in minutes. How long? 100 minutes. Yes, 100 minutes. It's hour and 40 minutes. Yes, and you explain the patient, please, Leah. About 2 hours, and after that, during this time, I will check your condition. Next, your patient need additional medicine, not only one. Your patient, you must change, for example, this vial finish. You finish administrate, and your patient needs new solution. You check and prepare this solution, clean it twice, like for other, and when you vial ready to the work, you place it on the free part of the stand. Explain the patient. Now I change solution. Close AV and only change position. It doesn't matter, and one solution or different.
What about this piece?
And yes, it's not forbidden. You can use this needle for air.
Ma'am, doesn't it react? It's not the same medicine.
It's inside your patient will too.
Inside the patient, take a mix
Now it doesn't matter. It's in one. And after that, you open. It's maybe now it's in this well negative pressure, and when you open, you see the solution finish.
So after opening one, you have to.
After that, you ask your patient, what do you feel? Check this part again.
How to receive?
And again, do the and next, today it's not one, today I show you 4 new practical skills. First, it's prepare AV to the work. Second, it's administrate first solution. Third, it's change the vial. And fourth, now I show you like you can administrate additional medicine when your patient live with AV. You prepare syringe like for intravenous injection. You check and prepare additional medicine.
Which color, ma'am? Which color needle?
Green එකෙන් vial එකට ගන්න.
For administrate solution. Aspirate. You clean this vial too. Aspirate. Like solution.
Spasiba bad.
Now what color ma'am? Which color? I got green.
remove
네,
there.
올리겠고.
And you need one swab. You prepare swab with solution and ask your patient. Now I will get your medicine inside your AV system. Do you have it before? And you clean only connector. Only connector, utilize with
just
swab.
once is enough.
And now you can use two-way. First way, you can close AV,
Okay.
but if you spend a long time and very hard regulates the speed of solution, more convenient if you after perforate rubber connector and pay attention when you do it after cleaning, like for intravenous injection or infusion. You take your syringe and your needle with open position and to support the stopper, perforate it, and now you or close AV or yes, take stop flow solution, you see. You understand? And take in same hand like syringe. And after that you administrate solution without swab. Remove the syringe and open. Remove your clothes and you see solution continue. Remove your hand. Remove your hand, sorry. Remove your hand. And you see what solution continue flow, continue administrate with like before, with need for you. Or you can close it, administrate solution,
And
after
open it.
that again open. It's not mistake, it's like convenient for you. And now please repeat how you will finish your
Is it
manipulation.
compulsory to face this part? Because it's so gano'n tayo kung gagawin din niya sa
Okay. Why you have to close AV when you get new solution during your infusion? Why you close?
AV. Because
If you will do it without close, the solution will flow
backwards.
in reverse. If you close it, you get solution in reverse. Understand? And when you finish your manipulative, you take, prepare clean swab with antiseptic solution, explain your patient what you will finish. Now I will remove this system, and after that you close AV, remove gauze and stitch and utilize it. But more often in patient room you will have addition trail and layer in this trail. Yes. After that you place swab with solution. Ask your patient, please bind your arm, fasten the needle in the stopper, and check condition your patient while the bleeding will stop. After that you check this place, remove your medical items, and go, and go in your patient room. And now you will utilize this and this part. You utilize in container of soft material. This needle, it's
Wrong
mistake. It's big mistake. You can take and with needle you must remove
Go together.
without your hand. After that you only open AV
This
in layer. It's in container with disinfection solution for medical items. This needle you can remove your hand and place in container for acute items. This is a special container for special oil and other you utilize like it. And after clean your table,
remove those.
you remove and utilize your gloves, re-clean your hands and check information about
Patient.
what you doing with medicine.
That's all. That's all.
Next class is 8 students will try show me all.
I'll show you now
this.
Please.
Show you this.
Practical.
Yes.
Do you want to?
Today you.
No, I don't know.
Now I give you try